Let me welcome everyone to another of our weekly security seminars. As a reminder on process, if you have a question for the speaker, please enter it in the Q&A, not in the chat. There should be along the bottom of your screen a Q&A icon that you can click on to put your questions there. And based on availability of time, we'll have those questions answered. But with that said, my great pleasure to introduce a longtime colleague and co-author and friend, Josiah Dykstra. Dr. Dykstra has racked up an impressive career as a researcher for some time at the National Security Agency, and then with the company Trail of Bits. He's recognized for work in a number of areas in cybersecurity, including in areas of psychology, economics, and forensics. He's a fellow of the American Academy of Forensic Sciences and a distinguished member of the ACM. And we were co-authors on a recent book on cybersecurity myths and misconceptions, which go out and buy yourself a dozen copies. It's a great book. But with that out of the way, let me introduce Dr. Josiah Dykstra to talk about a report that he recently co-authored. So Josiah, please take it away.
Thanks, Beth. Thanks everybody for joining today. It's a pleasure to be here. I'm sorry that I'm not with you in person, but I think we've all gotten used to these virtual talks, and I hope we have a good conversation at the end. I look forward to debating these ideas, hearing your feedback about them. It isn't fully baked research. These are a few ideas that some collaborators and I have had. You've had some of these speakers before. Adam, I think, is maybe even on the call. But I am here representing the work of a lot of people, certainly not my own. And I'm going to branch out a little bit even from the CRA paper, which I'll talk about here in a second, but to generally have a conversation about what can cybersecurity learn from another domain? And in particular, what can it learn from the public health ecosystem and the long history, longer than cybersecurity? What lessons can we draw? What ideas might we apply in cybersecurity to help achieve the goals that we want? 171 years ago, a physician, John Snow, someone who you might recognize, was instrumental in identifying the spread of cholera in London. And what turned out to be a very simple solution to limiting that spread was to physically remove the pump on a water pump, which was helping to spread cholera in a particular neighborhood of London. That wasn't the goal in the beginning, was removal of pumps, but an assessment of a problem that was causing great public health concern and turned out to be incredibly effective. This is a very convenient success story, but there are many others in public health. And it feels to me like we are fighting cybersecurity something like 19th century doctors. Sometimes we're developing solutions without truly knowing if they're going to work. And that has led me and others to think about how we can apply the lessons or the infrastructure like we have in public health, which continues to this day, not a solved problem, but a better understood problem in the last 171 years for collecting data, measuring outcomes, coordinating responses to achieve not only public health, but cybersecurity safety in addition. So I'll start with the end in mind, which is that I and these co-authors believe that the United States, other nations, and international groups need national institutions and frameworks to help make this future a reality. And we believe that there's lessons from public health, ideas about how they collect data, how they think about solving problems that are applicable in cybersecurity. We haven't done all of this work. We need your help in doing it. And we look forward to feedback about areas where it doesn't work, but the kinds of things that people are thinking about. This topic was presented as a research paper we helped co-write for the 2024-25 CRA quadrennial papers. If you're not familiar with CRA, it's one that you should be aware of. They do a lot of great work in computing and in cybersecurity, collecting information, disseminating information, promulgating good ideas. And on this quadrennial basis, they invite people to submit topics that are broad in nature and useful to debate because they have policy implications, and solving them would help a great big problem in cybersecurity. So this is the list of papers that have been published. The link is there if you want to go read them. The one I'm going to talk about now is ours, but there is quite a lot of breadth here, from quantum cryptography to education. And I think these are all important problems. I happen to think ours is equal among them, but you should know that there are others, and certainly to check them out. So at a very high level, let's talk about this discipline of cyber public health. The comparison between cyber and health has been around for a long time. We use similar language, similar analogies, sometimes similar approaches to problems. A little more than a year ago, there was a workshop, and the nonprofit CyberGreen, together with Google, hosted a group of people, including me in New York City, 35 rather diverse backgrounds and participants, to start to brainstorm, what does this problem mean? What does cyber public health mean as a phrase? Google, as a large industry partner, was eager then and continues to push this idea. They have talked about it very publicly and have honestly stepped up and said, we don't need to wait for the research to be done. There are things we can do now. We can start to collect data. We can analyze what might be done. Let's just try things and see what works. So the research and practice sort of running in parallel without having to wait one for the next. You can read that research, the report of that workshop. It's on the CyberGreen website, on link on the last slide. The three very high level outcomes of that workshop were that the 35 people in the room with a degree of diversity believed that cyber public health was a field unto itself, that there were specific tangible things that could be done, such as collecting the right kinds of data, and that it could help on a very large scale. So instead of just protecting me and my account and my laptop and my phone, what are the community aspects of cybersecurity, and how can we push research in the direction that helps big communities of people be safe online? Again, just like the traditional physical world, public health, this is a focus on large scale populations, not just single individuals. Where there seems to be quite a gap today is in, one, definitions, but two, the use of those definitions to measure how well we're doing. I think lots of people here in the webinar and others who will watch later would agree, we don't have very good measures of outcomes in cybersecurity. And that is something that public health struggled with. Now, they have a somewhat more straightforward goal, which is life. It's easy to measure human life, to measure years of human life, to measure the quality of life, the things that go into us as humans being healthy and happy and productive humans. That is a little less straightforward in cybersecurity. What are the things we should measure? Is it people? Is it devices? Is it accounts? Is it compromises? That there isn't as much of a straightforward definition, and this is worthy of some debate. But that is one of the things that the workshop and that I would advocate to say is sort of a prerequisite for doing a lot of extensive research. However, we do believe that that mentality and that kind of thinking, just like it has been shown to be useful in medicine, would also be useful to help in cybersecurity. So John Snow in London used a lot of expertise. He had medical knowledge, but he also used data. He had spatial data, statistical data. And I say that as a prerequisite, not that what we're advocating for is just better metrics. It's not purely a metrics question. Um, Many people would agree that cybersecurity is a very complex system. Almost no doubt about that. Many pieces of technology and human aspects and psychological, social aspects, all of which require some understanding. But there is data there that might be useful in the same way that it has been in public health. What I do want to point out is that in public health and over the course of many, many decades, there's sort of been three fundamental categories of things that are measured. And in the healthcare realm, one of them is populations. So that might be all the people who live in Mississippi. What is the spread of disease among that population? Or where in the geographical world is a new virus starting to spread? It has emerged. There's data to say that it is there and it is moving at such a rate of speed in the population. That is a way to sort of wrap the public health community's head around how much of a problem is this? Are we prepared to deal with it? How well are we doing in the mitigations among that population? So similarly is the need to define and use some kind of quantification of populations to help in cybersecurity. Again, that might be machines, accounts, or other things like that. But that's sort of thing number one and to be measured. Another thing to be measured are outcomes. As I said, human life, or the opposite, the death of that is one thing to think about. One thing that I find a relatively interesting concept are quality adjusted years. If I'm going to skip ahead here 1 second to just sort of show you what this looks like, which is a human who has a disease, has a different kind of life with that disease or the early death that is a result of cancer, diabetes, heart disease, whatever it might be. And that's a useful thing to measure in thinking about how do we help that population and how do we reduce the burden of that kind of disease. If we decide, for example, that in cybersecurity, the outcome we want to measure is, I don't know, patched software, for example, then what amount of time do we sort of quantify when the machine is not patched? Maybe when there's a patch available, but I haven't installed it on my machine yet. That could be a different kind of health than end of life software, where maybe there are no patches available. What does it mean for me to have a laptop for which I cannot fix the vulnerabilities here anymore? What impact does that have? And then what is the equivalent of mortality? Mortality doesn't give us a complete picture of the burden of disease, which is why daily adjusted life years is one interesting thing to measure that's sort of more nuanced than just death. And so we have populations, we have outcomes, and the third are the vectors of spread in public health, whether that's a plague, whether that's rodents, whether that's airborne diseases. Knowing what those vectors are and to have some statistical monitoring, some surveillance, health surveillance, to know how a particular problem might manifest in the physical world. Cybersecurity struggles with all of these things, not only understanding that malware can be spread in phishing emails or infected thumb drives or other kinds of things like that, but where is it happening in the world right now? To which population? And the sort of so what outcomes question. All three of those, I think, remain open questions in cybersecurity today. So in addition to daily adjusted life years, let me give you one more that I think is sort of an interesting way of thinking about cybersecurity, which are activities of daily living. For more than 50 years, the public health community has thought about very specific things that every human on the planet cares about doing every day: eating, bathing, dressing. There's not a very long list of them, but that is one way to measure the impact of a public health concern on the ability for humans to do those very fundamental things. The question is, what are the fundamental things we now rely on in our digital world that sort of are becoming necessary? Like you almost can't live your life without them. For example, not everybody does online shopping, but it is a pretty core part of our existence these days. And if there is some internet outage that affects my ability to purchase things online, that might have a meaningful impact on my life. on the outcomes that I sort of want for myself. I use GPS navigation. I spend a lot of time doing digital communications, right? Emails and text messages that use the internet. All of these things could become threatened by the lack of cybersecurity or ineffective cybersecurity. So this is an area where there's maybe rough parallels. I don't think anybody's fleshed out the right-hand side of this slide yet, but probably there are a list of sort of essential things that all of us as humans rely on today. We point out in the CRA paper that there's a shocking number of things that we don't know in cybersecurity. Despite decades of doing this and very smart people thinking about it day and night, um, the outcomes in cybersecurity are largely unknown. For example, how many data breaches were there last year? We have numbers, but they're probably not terribly accurate. And the result is that we don't know how much loss happened. We don't know how much money should be spent to prevent those data breaches in the future. Any number is a bad number, but the order of magnitude might be wrong because there's no mandatory reporting to a large degree, other than regulated industries like healthcare in America, where some data breaches must be reported. That isn't a universal requirement, nor is our capability, our capacity to respond to them. We don't know how many computer scientists there are in America. That's not a regulated, a licensed profession. In the public health sphere, we know how many hospitals there are. We know how many hospital beds there are. We know how many licensed physicians there are. All of that helps make public health make better decisions that to too much of a degree we don't know in cybersecurity. All of these would be useful numbers to have if we knew where the data were and if we could get it and analyze it. So we don't know, bottom line, we don't know that we're safer today than we were yesterday. Lots of us did work today. I did a lot of work in cybersecurity today, but it's a very difficult thing to measure. If I take this from sort of the end viewpoint, which is how would we know that we're doing a good job, that we're making progress in this field of cyber public health? What would that look like? What would we see? Maybe, for example, we would see a decline in successful attacks. We might be able to measure, gather data about that. And if cyber public health is making a difference, hopefully that number goes down. Those are quantifiable things. They might be proxy metrics to some degree, but at least we could start to measure them and see if those data are the right ones. No need to necessarily figure out what the ultimate data set is now. We should just look at what we have, and if that's insufficient, start to collect new data. Another indicator of progress might be the publication of vital statistics. So the equivalent of morbidity or mortality weekly reports, the kinds of things that the US federal government has collected in the past. We could start to see the publication of those in cybersecurity too. I think that would be an indicator of progress. Another might be some kind of lifespan, whatever that sort of means in terms of the days my computer is infected, the days I have confidence in the privacy of or the integrity of my bank account, but increased lifespans, that would probably be an indicator of success. Another might be updated standards. This is one way that we can come up with uniform ways of collecting and measuring and reporting data. And I certainly believe in what we proposed in the paper is that the federal government has an important role here that they could play. And why do I say that? One is that these large-scale population cybersecurity challenges transcend any individual person, industry, organization. So the health sector might like to do a good job, and they're working very hard on that. Individual hospitals and the health ISAC, many parts of the cybersecurity ecosystem care about improving the cybersecurity of that sector. But this is bigger even than that. It's bigger than just the health sector alone. Sector is kind of a way that the government distinguishes parts of the country, part of the economy, but most cyber threats don't live in one sector. So data breaches are happening in healthcare, sadly, but they're not exclusive to healthcare. And so we need a sort of larger scale institution and way of collecting data that it's hard to imagine someone other than the federal government sort of stepping in and doing that. The federal government, given their authority and their purview, also can coordinate things just on a way that is very difficult for individuals or smaller entities, foundations, et cetera, to do on their own. They have the purview, they have the authority in many cases to do that. In some sense, they have purse strings. They have a lot of money. They have more money than almost any individual entity has on their own. And they can use that to push things for good and ill that they want to see done. And so if cyber public health becomes a national priority, they can put funding and resources behind it that is not as easy to do from any other purview. And finally, they have the arm strength to facilitate the mandatory collection, in some sense, of cybersecurity data. They can regulate, for example, the healthcare industry and require the reporting of data breaches in a way that would otherwise have to be voluntary. And to some degree, we can try voluntary. It just doesn't always achieve the same kind of goals that the federal government might be able to do. The question, however, especially at this time in history, is what can be done if they don't do it? And this is a question I would love to debate with you at the end. We'll come back to this. What can be done if the federal government doesn't play that role? So we made recommendations in this report, and let me sort of summarize them. They cover a pretty broad spectrum. One is one that came out as long ago as the Solarium report, which is to establish this Bureau of Cyber Public Health Statistics, or cyber statistics in general. CISA has a new responsibility, at least within the last year or so, to be the agency in the federal government that collects that data. They are not the Bureau of Cyber Statistics per se, but have a similar purview in collecting that information. I haven't yet seen that produce the fruit that I hope it does, which is those data being collected and disseminated and making a difference. And so I still would love to advocate for some kind of entity that will fill the gap and help make the data collection a reality. So that was recommendation number one. Number two is to enable the federal government to do the kind of data analysis and outcome measurement that I think follows that establishment of a cyber health bureau, cyber public health statistics. We see this in some other elements like FISMA. So the Federal Information Security Modernization Act, FISMA, is a place that enacts regulation requirements from the federal government to various sectors that has an impact. And FISMA does offer a few of the things that we're advocating for in cyber public health, except that the cyber public health doesn't have an office or a department that is tasked to do that measurement. We might want them to do root cause analysis. Why did a particular problem manifest, and how well did we do about it, and how can we use the lessons learned from that? That, again, was a role that CISA was doing some of, at least last year. Now there is yet another gap there, and there isn't another institution who has stepped in to do that. So what could whole of government efforts be? In addition to just one office, one person, one entity, what could the government as an overall entity help push in this direction should it exist? One would be to incorporate cyber public health into some overarching strategy like the National Cybersecurity Strategy. If you've read these before, you can tell that they are very high-level goals, and other strategies nest underneath them. The Department of Defense almost always has a cybersecurity strategy that aligns or extends the national cybersecurity strategy more narrowly as it goes down. Cyber Command has a strategy that nests under the Department of Defense, and so on and so forth. But recognizing that cyber public health is an admirable goal would be something that could show up in that kind of a strategy. Another would be some kind of task force. If we can't get the problem sort of addressed in strategy alone, A federal task force has the reach, the arms to look across the federal government, because again, it might not be that just the Department of Defense or just Homeland Security has all the right knowledge, resources, access that they need to make progress on this problem. So a federal task force might be able to help do that. And a third option, not necessarily mutually exclusive, would be to develop some kind of national framework that would underpin and sort of be the foundation to help do a lot more data collection and research to come up with principles and methodologies that align with this goal of cyber public health. Can we get by without that? Maybe, but it would be much more helpful and much more timely if we had that framework. So let's talk for a second about institutions and data. Let's imagine a future state where there is a national cybersecurity public health institute. What would that institute do? I think they could oversee cyber public health initiatives in a similar way that the Centers for Disease Control, CDC, has a role in public health. This institute could do likewise in cybersecurity. It would be the sort of central hub for gathering data, analysis, publications, coordination, among others. Another option here is something like a data repository. A cybersecurity data repository would be a centralized, perhaps secure database where we could collect, analyze, share cybersecurity data, again, across sectors, not just in one, and probably would help accelerate research efforts. Data sets are so difficult to find, get, collect. This might be a way to overcome that challenge that we have today. Third would be some kind of standard. A standard is a way to get a broad, diverse group of people behind a similar methodology. I would love to see the development, implementation of some kind of standardized reporting mechanisms for cyber events. Even the ones that I see in healthcare, to Health and Human Services for HIPAA violations, don't always have that standardization behind them. It's certainly worth considering whether these standards should be mandatory for certain professions, certain sectors, certain criteria, but that is a conversation that happens when we've decided we're going to think about whether standards are the right approach. Number 4 is to incorporate long-term learning. We are very focused today on immediate threats, immediate consumer protection, and we fail to track and learn from sort of long-term incidents. So for many incidents, right, the attack mechanism sometimes is not known. And knowing how many incidents or why they're unknown would be a great learning opportunity that would help this field of cyber public health. I know we have researchers on the call and certainly don't want to neglect that that is a really important part of a new field, a new way of thinking. I would love to see federal funding or funding actually from anywhere that could help advocate or achieve more results in cyber public health. Federal funding would be great. Grants to people like you and me in the public and private sector would certainly be a way to do it. If that money doesn't come from the federal government, it would be the next best thing is to get some foundation and people who can make donations to push this research forward. Another area of research that we advocated for in the paper were stress tests. What are those sort of periodic tests about how resilient is critical infrastructure, for example? We have this to some degree. Some sectors are doing tabletop exercises. What would it look like if the power grid was disabled? What would it look like if the internet was unreliable for a significant amount of time? But that doesn't exist as much as it needs to now. Adam and I, for example, wrote a response to there was a new proposal for a national incident response plan at the federal government level. And Adam and I put some of these ideas in a response paper to them. Hopefully that will be incorporated. And it reiterated a lot of these same kinds of messages that I'm talking about today. So we're trying to do as much as we can in that small realm. Let me focus for a second on community. A lot of public health is centered around not just one person, one organization sort of making all the progress and doing all the work, but having a community of public health professionals in with many different skills in many different places who work together to help solve their problems. In cybersecurity, as you probably know, the getting the private sector to share data, use data, is often seen as too sensitive, an assumption that perhaps can be revisited in some circumstances. How can data be shared safely and securely and appropriately? But what are other incentives? What other economic mechanisms exist in terms of grants or tax incentives that would help companies want to collect and share data? Because if they don't have that, if the data already exists somewhere, if we just can't find it or afford it, maybe, that means that we won't make as much progress on these goals. And while my comments have mostly been US centric, which is one place to start, cyber public health is by, I think, its nature international. We will need international partners. The government will need international sharing agreements. If you have if you know people in other countries, I think they should be thinking about basically the same kinds of goals at their own national level, and eventually some kind of international agreement, just as we saw during COVID, where countries were doing sometimes their own responses, but COVID didn't respect boundaries any more than a cyber attack would. And so having those international communities and collaboration, I think, would be essential to seeing success in the future. So let me actually summarize two things at a very, very high level. Number one, we, the authors of this paper, Josiah included, really want a different future where we have something as admirable as the public health ecosystem, and that it is achieving the results of a more resilient, secure future. We think that having that in place would be a positive step in the right direction for long-term security in this digital age. Is there a way that we could live without cyber public health? Maybe, but it wouldn't be as good. It wouldn't be as effective. It wouldn't be as formalized. And cybersecurity for 50, 60, 70 years has been struggling with this problem. We think cyber public health is a tangible, concrete way to move the community in that direction. Not that we need to abandon the other efforts that we're doing, but there's so much that we can learn. Thankfully, there's this whole ecosystem of people in public health that we can talk to. We can try the tools and methodologies. I had a paper published earlier this year where we unearthed a tool in public health called the Hayden Matrix. It was new to us, and one of our colleagues in the public health sphere said, "Did you know this existed?" And we said, "No, tell us about that." And we tried to figure out, could it be applied in cybersecurity, and showed how that might be possible. There are many tools like that, daily adjusted life years, other terminology. Is public health the only way to do this? Is it the only analogy? Of course not. And we should be exploring the other ones. I have just been thinking about this one long enough to feel in my gut that it is a positive step, and I'm really eager to push the boundary forward. If you're interested, Adam and I wrote a paper last year at the New Security Paradigms Workshop. He's presented that here, I think, in the past, about pandemic scale cyber threats. The one I mentioned about the Hayden Matrix comes from the paper on the top, where we analyzed this analogy quite deeply to figure out, is it a good one or not, and then presented that use of the Hayden Matrix as an example of here's where it works and here's where it's less than perfect. But having thought about this for at least a year pretty deeply, I really do have a lot of passion for it. There are still questions on my mind and things where I would love your feedback. One is, who else needs to know about this? CRA will send the document directly to policymakers, lawmakers, technologists. If you don't want to send it to them directly, which you can, we can also ask CRA to send it on behalf of their organization to any of those people. If you know them, please let me know. I will make sure that that gets passed on. I am eternally interested in the intersection of cybersecurity and economics, and so incentives resonate a lot with me. I would love to know how to motivate more people to get interested in this. I can give talks like this all day, but unless there's a lot of people who take action, it will just be a hollow idea, and I would love to see it put into practice. And the question that I posed a little bit earlier is, what can we do acknowledging that federal leadership would be great, but without it? What's the plan B? Because I think we live in an age where that is necessary, and hopefully we don't need plan B. But I would hate for the idea to die just because, well, the federal government won't do it, so nobody will do it. That's not an outcome I'm very interested in. So in a second, I'll glad to check the Q&A chat. If you want to reach out to me about this in the future, this email is a good way to reach me, and I would love to always have a conversation about what you think about it. But with that, I would love to take questions and dialogue.
Thank you, Josiah. You have a question in the Q&A. Do you want to read those and answer them, or you want me to read the question to you and answer? How would you like to do that?
I see it now. So the question is, does the current administration give you pause on these recommendations? Here's what I think. I am no less interested, persuaded that this idea is important. The reason that I have started talking about what to do in the lack of federal leadership is really my reaction to the fact that I don't have a terrible lot of confidence that this administration at this point in history is going to be the ones to push the agenda that we've proposed forward. Not taking a political view on that, it's just sort of what I see. And I don't want that to be the detractor from anybody doing it. So love other ideas about where could leadership come from. Is that us as a collective of some kind? Is it an institute? Is it a not-for-profit? Is it, I mean, Cybergreen exists today. They would love more resources. They would love more workshops. But we will have to sort of band together, I think, right now to keep the momentum. That's where I see it. But thanks for asking.
Are there other questions? Great.
Analogies are one sort of interesting topic that I think lots of us have thought about in cyber before. Spaff and I wrote about it in our myths book. None of them are perfect, but that doesn't mean we should throw them out. It also means we should be careful about how we use them. So when I talk to a non-technical audience, a general audience, I'm a little bit careful in how I present this. This group, I think, understands where the analogy holds and doesn't. And I don't know if I've convinced you necessarily that public health is the one to follow, but there does seem to be a lot of leads worth thinking about. And I think that's a useful thing.
Yeah, I'll mention having looked at several decades ago when malware was really beginning emerging as a topic. There's been a lot that's been done on epidemiology for spread of various diseases and vaccination and so on. And a clear difference is that in the cyber realm, if a victim were to expire, you restore and reboot. But we don't do that in the real world. So a lot of the modeling that we do, a lot of the analogies don't really translate well from medical to cyber. And as you said, analogies are not perfect, and we really need to be aware of where those limits are when we approach some of these issues. I'll also mention, perhaps in the next issue of Communications of the ACM, there's going to be an article that Rich DeMillo and I wrote looking back 20 years on the CRA Grand Challenges report for cyber. So CRA has been interested in cybersecurity for a very long time and has sponsored several reports and workshops over the years, this being one of the more recent ones. For people who aren't familiar with CRA, It is the association of uh, organizations in North America that are interested in the production of research in computing, mostly universities, but also national labs, companies, government agencies, and others. And they do a lot of good work, scholarships, educational issues, informing federal government about issues as well as sponsoring these. So um, you can check out the Computing Research Association site for some of their past reports and information on things they do. Just putting in a plug there, I happen to be on the board of CRA, so I feel I should say something about it there. But this is a really good work, and the report is quite interesting. Um,
None of these are very long. I think there was a pretty short page limit on purpose to keep ideas not broad, but not overwhelming to people. And so all 9 of them, I think, are very readable, having looked at a couple.
yes. All right. Well, I think it was clear, and we aren't seeing other questions here. Um, we can we can actually add the report to our online archive if you want to send it to Mike, and we can add it into our online or any of the articles that you referenced as well. If they're available publicly, we have an online library. We at CERIAS, we can also add those in.
That would be great. I think having either an easy link or a direct copy just makes it easier to find the information when people are looking for it.
Yeah, yeah. If you just send Mike the items, he manages the archive. And for the people listening in, when you visit the CERIAS webpage under resources, you can see a link. That's also a place where we try to have copies of all of the dissertations and many of the published articles and tech reports that come out of CERIAS. So,
I'll also mention that we've created a cyber public health Slack channel. If you are interested in this and just want to follow along, we talk about ideas there. Send me an email. I'll put you in contact with people who can get you connected if anybody wants to.
oh, that's great.
I got a question that popped up. Let me read it and think about it as I'm reading. Um, I feel like it's really hard to get companies to be forthcoming about data breaches when it's not explicitly mandated by the law. The main backup I can think of is some sort of organization that can provide certification to companies that follow their policy, but that would require both a way to verify the companies are actually following the policy and a way to make the certification sought after enough that companies would be open about breaches. Do you have any ideas about how either of these challenges could be tackled? This is difficult, and there are certainly trade-offs. Um, the mandatory the mandatory option will get a lot of pushback, um, but that doesn't mean it's a bad idea. It doesn't mean it's the wrong one. Um, oh, and the follow-up conversation or the follow-up comment here is thinking about something like food safety certification. So that one, I hope, is mandatory in some sense for restaurants that have food safety standards. But that standard exists for a reason because the harm is outweighed by the burden of the certification or by the regulation, which generally is why there's regulation in healthcare, financial markets, financial services, and so forth. We need more measurement of the harm in cyber. I think that's one reason that we don't have this yet. Even though we have some statistics, as I said, about the number of data breaches or the number of um, financial loss, it doesn't seem to be changing behavior. Um, how many of us get notifications that there was a data breach and we get free credit monitoring, but we don't change our behavior? So that doesn't seem to be working for some reason. And so is the company going to be incentivized to follow some voluntary certification about their safety if they don't have to, and if customers don't demand it? Many software vendors now do better cybersecurity today than they did 10, 20, 30 years ago. in part because of consumer demand. So if consumers demanded a higher level or demanded certifications and labels, it's possible that would be the motivation. But customers aren't asking for it. If anything, they say, well, two-factor authentication is too difficult for my social media account. I'm not going to turn that on. I I wish there was another way, other short of you must do it, the sort of mandatory requirements. Um, but that might be the only way. If somebody has a different idea about how to do it better, I would love to see that. Oh, Adam reminds me that there's research into privacy seals. That talk might have happened here at CERIAS at some point too in the past. And yeah, Adam has a link. If everybody can't see that, I'll make sure it gets in the chat. Um, that companies with privacy seals were allegedly more likely to run scams. Communications of the ACM article on that. But CMDU has done tons and tons of research about will companies voluntarily do IoT security labels, for example, and will customers demand it? And in the end, does it help? Does it help people make better choices that leads to a more secure future?
Yeah, that shows up in a lot of places, including sort of certificates that people get, or in academia, the idea you have to publish to be promoted, but that then pushes the development of lower standard outlets. Um, that if we lose sight of counts or certificates, or we start focusing on those instead of what they represent, we can make things worse because people mistake the visible symbol for the underlying reality.
To me, one way to get companies more likely to participate in data, volunteering some data, is to make it cheap and easy. Have open source libraries, have low overhead to them have some financial security that the information will be only vetted people have access to the information, or it will be anonymized sufficiently. Um, they just feel like it's a risk today. Like there's no benefit, only risk. And if we can lower some of that friction by making it cheaper, easier, in their interest to do, maybe they would be more likely to volunteer.
How do you think the CMMC fits in this?
I haven't thought about the connection here enough. CMMC hasn't been around long enough, I think, for us to see the benefits. It has hit some bumpy roads, but at a high level, it has admirable goals. I think the implementation has been a bigger barrier.
Mm-hmm. Now we saw something like that with the rollout of GLB requirements a decade ago.
Even the burden on CMMC could be eliminated. I mean, it could be maybe not eliminated, but reduced. If there was a company that offered a CMMC cloud instance where it was all the things that you had to do were in place, that would be much easier than somebody saying, well, I need a cloud service for email and I have to do a checklist of 1,000 things. And even then, maybe I don't do them right. Um, we could lower the friction. But thanks for the questions and comments.
All right. And thank you, Adam, for that pointer as well. Um, well, this is great. Thank you so much for the talk today. And for our participants, we will be doing this again next week. And so you can check out the webpage for the next few weeks, and we're already scheduling into the fall. So please continue to join us on Wednesdays for some stimulating and thought-provoking discussions such as this. And I'm sure that if you have follow-up on this, You can find contact information for Josiah on the web, and he's generally pretty responsive. So thank you very much, Josiah.
Thanks for having me. I really enjoyed it.
Everybody have a good afternoon. Bye-bye.